Vanakkam. Welcome to this course on biomedical instrumentation. In the last week, we looked at electrode theory. We could not finish electrode theory in the last week. We continue electrodes, our discussion on electrodes in this week for a few lectures, and then we will proceed with the rest of the topics, because it is not about how many topics we cover. First of all, it is not about covering things, it is about uncovering some of them. It is about opening up that world, going a little deep so that you can master the few concepts that are discussed in the course. It is not about teaching a lot of concepts. Those that are taught, you go a little deep. That is the objective. So, we continue our discussion on electrodes. In this video, we will look at body surface recording electrodes, that is surface electrodes. How do we use electrodes placed on the surface of the skin to record biopotentials from the body? These can be any kind of biopotentials. This can be muscle activity, this can be heart activity, this can be brain activity, for example. Here we are not looking at what type of activity it is. Here we look at electrodes and the design, approach towards design of the electrode and other such details of surface electrodes. So, there are a few ways in which you could classify surface electrodes or body surface recording electrodes. Of course, you could stimulate from the surface, so that is why it is called as body surface recording electrodes. So, recall our earlier discussion. In general, if it is a recording electrode, you are looking at non-polarizable electrodes of the type silver chloride, or if it is a stimulating electrode, in general you are looking at electrodes that involve polarizable electrodes like platinum, for example. Of course, variations exist and details will vary, but this is the general theory. So, the first type of electrode is the metal plate electrode. This essentially contains a metallic conductor that is in direct contact with the skin. Now, direct means through a gel or a gel soaked or electrolyte soaked pad to establish and maintain contact. Frequently what is used in ECG, for example, is this type of electrode, is the metal plated limb electrode used quite often in ECG. This is the metal plated electrode used for limb. Note its curvature, suitable to be placed on, for example, the arm or for example on the leg. Also, because it is ECG, there are only so many electrodes that you need. How many electrodes do you need? Well, if it is the right leg driven system, then you will need 4 electrodes, but the number of leads are different. Now, that is a detail that we will see in future classes of this week. Now, because of that, because the number of electrodes are quite limited, small in number, you could actually have a larger surface area. What is the advantage of having a larger surface area electrode? That I can minimize the impedance. Note that it is always a trade off between surface area and impedance. If the surface area is very small, like in the case of the microelectrodes that we looked at, impedance becomes very big. Especially in the case of micropipette or glass filled electrodes, and because there are also capacitive effects that come into the picture, which we have discussed in the previous weeks, or just reminding you that. So, impedance becomes a big factor in really small sized electrodes, but in this case we are looking at surface electrodes, those that are quite big, because last week we looked at microelectrodes of the order of sizes we were looking at were 50 nanometers to 10 microns. Right? These are quite visible, relatively big. you know, for example, this one is going to be several centimeters in size. This metal plated limb electrode is going to be several centimeters in size. So, that is quite big when compared with microns nanoscale that we were looking at the previous weeks, right. And this one is traditionally made from German silver, which is essentially a nickel silver alloy. This is a very rugged alloy that is used to fabricate this electrode, because this is quite often used in primary care setting for repeated applications. So, this is used across patients for repeated applications. You just put the gel and then put it, and this is going to last for a very long time. That is the limb electrode. Then you have the metal disc electrode. This is sometimes used depending on the application for various recording purposes. This is placed on the surface and tied or held in its place through surgical tape, right. And this has a lead wire soldered or welded. Remember, if you solder, there are other pictures that come into there are other things that come into the picture. We discussed in the previous weeks why you should not use dissimilar metals, because there are other things that come into the picture. So, maybe it is preferred to weld this as opposed to solder this, because if you solder, there are two contacts that come into the picture, the metal electrode with solder and solder with the lead wire. There are two contacts, and in each of these there are impedance effects that come into the picture, right. Which is why welding is preferred as opposed to soldering. So, depending on the application, depending on the rugged need, depending on the sensitivity that you need, it might be soldered or welded, but just saying which is the preferred this. On the back surface of this electrode, maybe you have welded the lead wire. Quite often used with ECG, it is made of a disc that is made of silver with electrolytically deposited layer of silver chloride on the contact surface. Note what was the challenge with the electrolytic deposition for silver chloride. We discussed that, because silver chloride, when it is electrolytically deposited with repeated use, there is a chance that it will get scraped off. Silver chloride salt will get scraped off due to mechanical wear and tear. When that happens, it is possible that silver will directly contact this. Note that silver cation is toxic to the cells, is cytotoxic, not silver itself. Silver cation is cytotoxic. So, it is not, that is one reason. The other reason is it is electrolyte in the body is composed of chloride, which is why you are going for silver chloride. That is our electrode theory, recall this, right. So, it usually has a electrolytically deposited layer of silver chloride on the contacting surface, and sometimes it is made of stainless steel. For EMG applications, it might be made of stainless steel or platinum or gold plated discs. Sometimes for EEG, quite often gold plated discs are also used to minimize because gold plated gold being the noblest of noble metals, platinum, gold, there will be minimum reaction, minimum chemical reaction, that is the idea. So, in these cases it essentially acts as a polarizable electrode, and polarizable electrode means we immediately know what it means, because if you recall polarizable electrode and its equivalent circuit, there will be a displacement current and there will be capacitive effects that come into the picture. That means that whenever there is a movement of the electrode, when will there be movement? When the skin moves, when the person is moving. If it is EMG, the person is moving, there will be a slight stretching or shrinking of the skin as the person is moving. When that happens, there will be motion artifact. Sometimes in EEG especially, motion artifact and the signal of interest have common frequency and amplitude characters. It will be very difficult to remove them. We discussed this in the previous weeks. The other idea is, this is the most commonly used method, the most commonly used electrodes is a disposable foam pad electrodes. What they use, what they have is foam based electrodes that have that are disposable. So, and with gel pre-coated, you just take off you just take off the label and stitch it and you are done. and then after the patient and then you attach lead wires directly to the back side of this disposable foam based electrodes to the back side, like this for example, right. To the back side you attach the lead wires and you record. After you record, you remove the lead wires, and then the patient themselves can remove these electrodes, because if you have gone through ECG once, you know, because if somebody else is removing, if there is hair on the body for example, it is quite irritating when somebody else removes, because you can't really predict other person's movements, but if you are removing, you can do it with such knack that or at least you think that you minimize the pain or discomfort, whichever way it works. Right. It is quite often used with ECG monitoring. It has a relatively large disc of plastic foam with silver plated disc that is used as electrode, and that is coated with silver chloride. Because this is disposable, we are not worried about the electrolytic deposition or scraping off of silver chloride. This is not an issue, and a layer of electrolytic gel covers the disc. It comes with pre-covered this, so you just take off that label and it is ready to use. And the electrode side of the foam is covered with an adhesive material, so you just stick and then it sticks. Usually it is quite because it is disposable, you are only looking at single use or a few minutes of use. So that is the other one. The other one that is quite often used in ECG, especially in the precordial leads. When we look at ECG, we will look at what these are. Precordial leads are the leads V1 to V6 in ECG. These are the precordial leads, or the chest leads of this in ECG. In this case, the advantage is that they are used as suction electrodes. We use suction electrodes for this purpose. So what we do is that there is a rubber bulb that you squeeze to push air out, and then you fill this region of the electrode with gel, and it turns out that the rim of this electrode is the contacting surface. The rim of that electrode is the contacting surface, and near there you place the gel, and you, after you squeeze the bulb and place it in the appropriate place, once you place, you just remove it, and because there is no more air, because air cannot get inside, it just sucks into the skin of the person, and it does not require any other form of adhesion to the body. Right. So it can, but then the problem is, after some time, slowly small amount of air will start getting inside, and then it might come off. So it can only be used for short periods of time. It can only be used for few minutes. It cannot be used for long term monitoring. We already defined what is long term monitoring. Long term monitoring means several hours to several days. If you are going to a primary care center and getting one ECG done, say for example, it is going to take you 5-10 minutes, this one will work quite well. Then you have floating electrode. We already discussed the advantage of this type of electrode. This is quite often used to minimize motion artifacts. Right. In this case, what happens is that there is a metal disc, that is here, and then you have a double sided adhesive tape here between, between the two you have the electrolytic gel. If the electrode is moving, if there is movement of skin, that is felt only by the electrolytic gel and the insulating material, but not by the electrode itself. This is a method, mechanical method to minimize motion artifacts. This essentially removes the electrolyte interface from motion artifact, minimizes. To a large extent this works. It's one way to avoid the motion artifact. Other designs are given. I request you to go through these other variations of or other views of this design. Again, these pictures and the previous pictures are adapted from the gold standard textbook of J.G. Webster, right. Then you have flexible electrodes. Now, if you are interested in measuring from, for example, from baby, right? You cannot place the regular lead or this, because it is going to be quite painful for the baby, and because of, not just painful, the baby's skin is very sensitive because of that. So that you use, there are different types of these that come. One is the carbon filled silicon rubber compound, the conductive electrode in the form of a thin strip like this, like that, right? Like that, and then that is this is used as the active element of an electrode. Now, the carbon particles essentially act as the conductor, act as the electrode, and the pin connector is pushed into this. This pin connector is pushed into this hole here to make it equivalent to a metal electrode. What are the applications? Now, the applications of these involve essentially monitoring of infants, usually premature infants who weigh below 2.5 kgs, for whom we cannot use standard electrodes. The other is a thin film neonatal electrodes of this type. Right. In this case, there is a really small film. This is a mylar film that has a silver chloride coating on that. Right. This essentially has a thickness of about 13 microns. Right, with silver chloride. The other, this is another view of the same electrode. So this is the lead wire. That's that lead wire, and this is the silver. So this is the silver chloride electrode with the mylar substrate, and you place that on that. Why is this so critical? Because if you place the regular metal electrode, the baby's skin is going to be scrapped or scrubbed quite seriously. So you want to use materials that do not affect the skin of the baby in a very big way. Then this is an up and coming field, which is the fabric electrode. This is the wearable device. This is the wearable revolution that is there. These are dry electrodes that are gaining traction nowadays, because they can be used to track for a long time, continuous, relatively remote monitoring, physiological monitoring. What are the applications? Especially to monitor neonatal respiratory activity, because in babies, respiration, is not, especially in premature infants, respiration is not quite natural all the time. Sometimes they may simply forget to breathe. Yes, it does happen. There's a syndrome called, SIDS, and read what it is. Okay, sudden infant death syndrome. Sometimes the exact cause of physiology behind this is a huge topic of debate, which is beyond the scope of this course. But especially premature infants, below those who are born below, say 30 weeks, 28 weeks, this do not really have a well developed respiratory system, so they can breathe on their own. So it is important to monitor their respiratory activity and to measure vital signs in elderly patients at home. So if people are at home and you want to monitor them from a distance, so essentially through wearable devices, through the internet. Yes. And you want to observe how the first responders are behaving in emergencies. So used to train the first responders and to track the health and status of army or defense personnel during combat. Is the person alive? Is the soldier alive? Or if so, what is the condition of the soldier? Essentially to use this, because if I use a separate electrode, then that becomes there is extra baggage that comes with the electrode, and this. If it is a regular fabric that the person is wearing, then the person can simply wear it, right? So this essentially is used quite literally seamlessly integrate the sensing element the sensing part of the system into the fabric that they are wearing for relatively long term monitoring, that is minimally invasive. Anyway, people are going to wear some clothes. So, that is the advantage of this. This is up and coming, not fully into field use, but this field is quite promising. So, this essentially summarizes the various types of body surface recording electrodes. So, you have the metal plate electrode, which is quite often used. The example is the limb electrode in ECG. It is reusable, it is quite simple, it is quite rugged, but it requires straps, sometimes prone to some artifacts. Metal disc electrodes essentially come with silver chloride or gold metal discs that are taped using surgical tapes, quite often used to measure EEG and surface EMG. This is quite low in cost and reusable, but they act as polarizable electrodes. So, that means that they are sensitive to motion artifacts. Foam pad electrodes use silver chloride discs and that have pre-filled gel and adhesive. Quite often they are used for ECG monitoring. That is very hygienic because these are disposable electrodes, and the problem is for long time this cannot be used because gel will dry. It's single use. Suction electrodes are quite often used in precordial ECG because it is held in place by negative pressure, but after some time it will give away. It can only be used for short durations of from few minutes, maximum I do not know, maybe half an hour to 45 minutes. After some time it will just give way, and it is quite uncomfortable to wear for a long time because it sucks onto your body. Floating electrodes essentially floats in the gel well. So, there is a huge amount of gel within which the electrode floats. If there is any motion, that motion is happening between the skin and the electrolyte gel and not between the gel and the electrode itself. So, this is one way in which you could mechanically reduce motion artifact, right. But the design is quite complicated, the cost is quite high. Then you have flexible electrodes that are quite often used in neonatal use and premature infants to monitor this. It is quite soft and conforms to the skin and does not hurt the baby's skin, but it is quite fragile and it cannot be reused for many times. Then you have the fabric electrode. This is the future of the electrode technology, essentially wearable conductive textiles that are integrated into garments that people are already wearing. This is used for monitoring first responders, this is used to monitor patients, this is used to monitor military personnel, this is used to monitor babies. So, this is comfortable because people are anyway going to wear some clothes and can be used for a long time, seamless integration. But the difference is because this is dry, signal quality will be compromised. So, you are not going to get clinical quality signal with wearable and fabric electrodes. You will get to know whether the person is alive or dead, or some quality, you will get some quality, but you are not going to get quality that is comparable to the clinic quality. You need to, because this is remote monitoring, right. With remote monitoring you will get some quality, but it will not be as good as the quality that you will get inside the hospital in the clinical setting. I mean, you cannot have the cake and eat it too. You should compromise a little bit on the quality of the signal when you use wearable or fabric based or textile based electrodes. With this, we come to the end of this video. In this video, we looked at body surface recording electrodes and discussed the various types of these and the applications of these. With this, we end this video. Thank you very much for your attention.